Hi guys, this is Preeti and you're watching my dissolution. In this video, I'll be saying about the pharmacokinetics. Pharmaco means drug, kinetics means movement. That is, movement of the drug in our body is known as pharmacokinetics. While the drug is moving in our body, there will be body will be doing something on the drug. Na, what it will do? It does absorption. What the body does to the drug is known as pharmacokinetics. It absorbs the drug from the GIT, like a GI tract, and then it distributes through the absorption includes from the GI tract into the systemic circulation. It includes the absorption. From systemic circulation, it goes into the heart. From there, it is distributed to the various tissues. So this is distribution. Then, into the metabolism takes place in the liver or in other GI tract. There will be metabolism. Finally, it has to be excreted. Now, if it stays in the body, then it starts get accumulated, and then there will be toxicity, and then toxicity and other adverse effects we can see. Or else, if we take once a tablet, that will be like enough. We need not to take again. If you get fever, you need not to take any tablet. Like that, the situation would have been if that was the case. So there after metabolism there was an excretion of the drug. So the tablet which you are taking, that is going into the GI tract, then in stomach it undergoes first the disintegration. That means it become in a powder form, then dissolution in a solution form. So as the name says, dissolution, it takes a time na. Like if dissolution time and disintegration time are less, then absorption will be faster. After becoming powder and then solution, it absorbs. Then it is absorbed into the from the intestine and all. It is absorbed. Then it goes into the liver through the portal vein, and then liver that undergo metabolism. Then from inferior vena cava it enters into the heart. From heart it is distributed throughout the body, and then again distributed from the renal artery. It enters into the kidney, and then all these processes, tubular reabsorption and then secretion, everything will be happening, and then finally which is not required, that is excreted from the body. This all this cells will be having the bilipid layer. So like this all like so lipid soluble drugs only can pass through the lipid bilayer. Water soluble cannot be passed. There need aquaporins and all those. Absorption, it includes from the route of administration. Till it enters into the blood vessels, into the systemic circulation, it is called as absorption. Then the route of administration, it varies different. It may be systemic route of exhibition or local. Local means this is considered as a body of a human. Locally, here the action of the drug is required. You give the drug here only. This is known as local application of the drug. Or a systemic means it includes you take the orally somewhere, the action should be there for a brain or something. Again it absorbs, it goes into the blood. Again through the blood it goes to the brain. That is known as systemic effect. In systemic effect there are enteral and parenteral. Enteral means it includes GIT, whereas parenteral it won't be other than GIT. What are the routes will be there? Then enteral, first oral route. GIT means from the mouth till the anus rectum. From oral and then rectal, between the tongue, on the way there will be below the tongue, that is sublingual. Sub means below, lingual means the tongue. Sublingual, these are the routes in the enteral route, where other subdivided in the enteral route. And in the parenteral route, parenteral means other than enteral route, that means intravenous, into the vein, intradermal into the skin, dermis of the skin, intramuscular into the muscle, and subcutaneous. Inhalation, fastest absorption, fastest way of absorption, because the surface area of the alveolus is enlarged. Sublingual is also fastest only, but not it will be less faster than the inhalation surface area will be large. In sublingual, under the tongue, the surface area will be less. So inhalation is the fastest route for drug absorption. And then intraosseous into the bones, and then intradermal, transdermal. These are the examples for the parenteral routes. In IV you will see the bioavailability 100%, because what is the drug form which we have given, that will be available in the systemic circulation, is known as bioavailability, unchanged form. Intravenous we are directly given to the blood, so the availability of the intravenous drug will be 100%. And the local, we apply on the where the action is required, we apply there only, that is known as local. Further divided into tropical, that is on the surface like a skin or mucous membrane, or into the deeper tissues. Example, the tropical will be skin or the mucous membrane, whereas in the deeper tissues it include intrathecal, in the subarachnoid place we inject or give, or intraarterial or intraarticular, near the articulations of the bones we give. And this is all about the routes of drug administration. And absorption, absorption I said for absorption it has to pass through the bilipid layer, lipid bilayer. This is a lipid, so like dissolve, like so lipid soluble only can cross this membrane. So lipid soluble means unionized form. It should be in an unionized form in order to absorb. If it is a strong acid or strong base, this will be obvious, no? HCl you take, this is a strong acid, it undergoes dissociation to form H plus and Cl minus, so it can be easily ionized, so it is poorly absorbed. It should be in an unionized form in order to absorb, but it is ionized, so it is poorly absorbed. Strong acid and strong base are poorly absorbed, whereas weak acid and weak base, you take first weak acid. Weak acid, it will, if it is in a basic media, acid base will react to form salt and water. If it is an acidic medium, it remains in unionized form, so easily absorbed. If it is a base in acidic medium, it undergoes like a dissociation and combines with other form and to form salt and water with a acid. So in a basic medium, it remains unionized form and it is easily absorbed. So for absorption, for weak acid we require acidic medium for a faster absorption. For a weak base we require basic medium for faster absorption. Where you can see in a GIT acidic medium, that is in stomach. So acidic drugs are faster, like absorbed more in the stomach. Example, aspirin. Acidic drug is a aspirin. Basic drug we require basic medium for more absorption. That is in example for this basic drug will be morphine. In the intestine, morphine will be absorbed better. But however, the acidic drug or basic drug, intestine has a larger absorption area. Surface area will be very large, so maximum absorption will be in intestine only. But for acid, weak acid and weak base, this will be a condition. Absorption may be active transport, passive transport, facilitated or simple diffusion, or endocytosis. It engulfs and then do this. Then we speak about the bioavailability. Bioavailability means how much the drug will be available in an unchanged form in a systemic circulation. This is known as bioavailability. And then bioavailability of the IV, I already said, directly it enters with the drug, we directly give into the intravenous. So bioavailability of the IV will be 100%. In order to calculate the bioavailability of the other drugs, we calculate the area under this curve. Area, this is the oral dose. First you are giving, this is a time, this is a 0 time, this is some time. First you are giving, that has to enter and then absorb. No? The concentration in the plasma will be increasing. Then after it is excreted or metabolized, the concentration will be decreasing. For in IV, we directly give into the arteries or into the blood. So the concentration initially will be more, then maybe undergoes metabolism and then it will be decreased. The area under this intravenous, this is the area under the intravenous, this is the area under the oral. In order to calculate the bioavailability of any oral drug or any drug, we calculate the area under the curve oral drug divided by area under IV into 100. This gives the bioavailability of that drug. Then we come for volume of distribution. This is absorption and absorption over. Now distribution, in distribution we have volume of distribution. Volume of distribution is inversely proportional to the plasma concentration. If the plasma concentration is more, then it won't be available in the tissues. From plasma only, that has to go to the tissues. Now everything will be present in the plasma itself, so there won't be anything in the tissues. So volume of distribution is inversely proportional to the plasma concentration, as volume of distribution formula will be amount of drug in the body divided by concentration of the drug in the blood plasma. So it is inversely proportional. If volume of distribution is more, then we cannot do dialysis, because one person comes with a poisoning case, the drug concentration will be more in the more, it will be having more volume of distribution, so the drug goes and accumulates in the tissues. If you do dialysis also, no use, no, because that won't be present in the plasma in order to remove from the dialysis. In case of the drugs with high volume of distribution, we cannot do dialysis. This is one point you have to remember so that you can solve the MCQs. And we come for elimination. Elimination, there will be first order elimination and zero order elimination. First order elimination, as the name says, the rate of elimination will be directly proportional to the concentration, plasma concentration of the drug. This boxes indicates the brackets indicates the concentration. Concentration of the plasma concentration of that drug. So order will be 1. Here it will be constant. So plasma concentration of the drug will be 0 order. So this will become constant. So rate of elimination will be constant in 0 order, whereas how much ever the drug will be 1000 grams initially, it becomes 990 grams, you think. Even if it is 100 gram, the concentration is there, still there will be 90 grams only 10 grams is decreased. But whereas here there will be fraction of decrease, half you think 100 milligrams was there initially. And then here, if at a first order 100 milligrams were there, then it becomes half. The fraction is eliminating, that 50 it becomes, then 25 it becomes, 12.5 it becomes, like that. So there won't be any problem of this. Here there will be overdosage, like the toxicity problem will be there in a zero order. If even though this is 1,000 grams or 100 grams or 1 lakh grams, anything, there will be constant elimination. That is, only 10 grams is eliminated. So from 1,000 it becomes 990, from 100 it becomes 90. So there will be a problem. The graph for this elimination of first order, it appears like this, because the fraction is eliminating, so exponentially decrease. This is the rectangular hyperbola you will get, whereas here this straight line you get, because this is a constant, so straight line you will get. This is a constant rate of elimination will be there. The steady state is a state where the steady state, when we say, means the plasma concentration will remain constant. It attains at 4 to 5 half-lives. If you think the half-life of certain drug will be 2 seconds, means 0.2 seconds, means after into 4 to 5 you will do, after 0.8 to 1 second, like 1 second, it will be attaining the steady state of the drug we can see in the plasma the elimination, for elimination, I already said, for absorption, for acidic drug, acidic is required for absorption. For base, weak base, basic medium is required. Whereas for elimination, it should become, in order to eliminate, kidney, you consider where the elimination takes place, kidney, in order to eliminate, it should be ionized form. Ionized form means it should be, for weak acid, there should be base, so that ionize, it breaks now. So it breaks as weak acid, plus or minus, it breaks, and then it is easily eliminated. It should not be unionized form. Unionized means combined form. It cannot be in combined form. So for a weak acid, we have to do alkylate the urine, so that we can eliminate. For a weak base, we have to do acidification of that urine. This is all about the pharmacokinetics. Pharmacokinetics, you learnt what are the basic compositions of this, and then how absorption, how route of administration you learnt, what is absorption definition you learnt, and how absorption, like favorable conditions you learnt, and then the modes of absorption you learnt, availability, volume of distribution, first order and zero order kinetics, difference between them, steady state, and then elimination. This all you learnt in this video. If you have any suggestions, let me know in the comment section, and if you find this video helpful, please do like, share and subscribe to my channel.